The first one is nasal sinus irrigations, or basically rinsing out the nose with salt water. So what you do is use distilled water or previously boiled water, pour it into one of those sinus rinses along with a salt packet, and literally irrigate out the nose. And this helps to rinse out mucus, other allergens, things that can lead to us having inflammation inside the nose. And also it's just good for nasal hygiene moving forward. Another mainstay of treatment is our topical nasal steroids. So a lot of people have heard of things like fluticasone or the brand name Flonase. This comes in a couple other types as well, like mometasone or budesonide sprays as well. And what this does is you spray it in the nose and it coats that lining to help control the inflammation locally inside of the nose and at the outflow of those sinus passages. And it doesn't quite get absorbed into the body like regular steroids do, so it's much safer to use, especially longer term, and very effective in relieving a lot of the symptoms of chronic sinusitis as well. Other considerations for treatment include oral steroids, like we just talked about, which are these tablets that you take in your body that are then absorbed throughout the body. And they work effectively and they work potent, they work strongly as well. But we typically don't like to use that repeatedly, as that can have more deleterious effects longer term on your body. But they are an important kind of workup and treatment plan for some patients with sinusitis that we do offer. And next would be certain antibiotics, especially if someone has signs of infection and not just inflammation inside of the nose. So there are some types of antibiotics that we will sometimes use for up to 3 weeks at a time to try to help clear out the infections and get those sinuses working appropriately, aerating appropriately, and feeling better like we should. And last, we have other medications that we usually treat with comorbid allergies, so patients that are suffering with sinusitis but also have allergy symptoms. And some of those things might be like the topical antihistamine nasal sprays, or even oral antihistamines, like Claritin is a common one that people have used before in order to try to help with some of those allergic type symptoms as well. And in a few instances, patients may continue to suffer from their symptoms despite attempts at prior medical treatment or even prior surgical treatment. And in these cases, we turn sometimes to these newer medications called biologics. These are medications that are dosed kind of weekly or monthly, and their goal is to kind of modulate the immune system and our response that our immune system has in its role in development of chronic sinusitis. And these medications, they're useful when needed, but they're typically more of a last line treatment as we see them right now with our research to try to help patients that have refractory disease despite attempts, like I said, at medical or surgical management. The goal of the combinations of medicines that we talked about is really to open up those sinuses, decrease the inflammation, allow for better aeration of the sinuses like they should, and drainage, and get us feeling better and improve our quality of life.